To see you all here for Sub-Working Group 2.2, December session of the Sub-Working Group for the Global Coalition to Address Synthetic Drug Threats. I'm going to start with some administrative announcements. First, an announcement on a synthetic drug resolution. The United States is sponsoring a synthetic drugs-focused resolution in the UN General Assembly plenary with the goal of adoption by consensus by all 193 UN member states next Monday, December 18th in New York City. The United States introduced this resolution to highlight emerging global issues related to synthetic drugs and to urge widespread adoption of unified support to address their associated public health and security challenges. This resolution aligns with US efforts to enhance international cooperation on this urgent issue through the Global Coalition and ongoing efforts in the UN Commission on Narcotic Drugs. We urge your governments to demonstrate strong support for this effort to further elevate synthetic drugs as an urgent international priority by co-sponsoring this text and by voting in favor of this issue. The next announcement relates to civil society engagement. Some of you may recall that in the July 2023 Ministerial Declaration on Accelerating and Strengthening the Global Response to Synthetic Drugs, the participating governments expressed their commitment to take into account input from civil society in the coalition objectives. As you know, these coalition meetings that we have every month are limited to only governments and international organizations. So we've developed a plan to establish a mechanism to solicit civil society input. Those plans will be listed on the coalition website that you see there in the hyperlink, and they are the following. One, we will begin encouraging countries to host national dialogues for with civil society organizations between governments and civil society. The United States is going to lead by example. On the 27th of January, our White House Office of National Drug Control Policy will organize a national U.S. roundtable with U.S. civil society organizations, and we encourage other countries to do the same. If you do, please prepare a brief summary report that we can post on the website, as we will be doing after our January 27th event. Second, the Global Civil Society Forum will be organized by the Vienna NGO Committee, the NGOC, and that will be a 3 to 4 hour global session that will involve statements from civil society organizations also at the end of January. Third, we're looking for exchanges of experiences that will be posted on the coalition website between the months of January to April. So we will encourage civil society organizations to record content that we can upload to the coalition website under a new section that we will create for civil society input. Fourth, we will be looking for concrete recommendations from civil society organizations in terms of opportunities they see in working with governments or initiatives that they can carry out on their own. Those, again, we will post on the website, again, between January to April. And finally, we will encourage civil society organizations to share their achievements with us in terms of action and concrete initiatives that they have started, initiated, expanded, and those will be posted between April to July. Finally, at the discretion of the co-chairs, we will also invite co-chairs to determine whether civil society representatives should be invited to any of the specific sub-working group meetings. And we would create a new link and a specific session for those meetings to take place. We would obviously inform the members of the coalition if there were civil society representatives in some of these sessions in the future to have a sort of a deeper dialogue with them. So I have one more administrative announcement, and that is, please visit the Global Coalition website, globalcoalition.us. On this website, you will see information about the sub-working groups, and the upcoming agendas will be posted there. So as these take shape, we will be updating these on a recurring basis. You can see, for example, the December session and the past sessions that have already taken place. You will be able to find the recorded videos there underneath that in a timeline fashion. So I also want to share with you all the invitation that if you have your own content that you would like to submit in terms of longer presentations, postings, videos that showcase the success and initiatives that you have in your countries, you are also most welcome to share with us those links, and we will also provide those videos there for coalition members to review as well. And with that, I'm going to turn it over to our co-chairs for today, Amber Migas, Shane Nielsen, and Sanou Pepelineko for their presentations. I'll stop sharing now and over to our esteemed co-chairs. Thank you so much.
Welcome, everybody. Our first presenter today is Martin Raithelhuber, is an illicit synthetic drug expert from the UNODC's Global SMART program, who will be presenting to us today on the UNODC's Tox-Portal. Welcome, Martin.
Hello, good morning, good afternoon, everyone. Can you hear me well?
My apologies, you are very distant and very echoey. Can you speak much closer to your device, please?
All right, I'll try it again. Let's see. There's something I can do with the settings.
Perhaps just try to speak closer to your computer, and we'll see if that helps, please.
All right. Just give me a second, please.
Thank you. Because it looks like it seems your device is not recognizing your microphone, so...
Yeah, I think that's the problem.
In that case, the only solution would be to try to speak closer to your device and see if that helps. And we are not getting audio from you, unfortunately, so you may want to make sure that you selected your microphone in Zoom correctly. You need to go to the bottom left-hand corner, click the arrow next to your microphone button, and see what is selected for your microphone. And another option that you can try is simply unplug your headset and try to talk to us without a headset.
That's what I'm doing, and it looks good on my side.
Very good. It's much better audio. Please go ahead.
Perfect. So sorry for the short delay. Yeah, I'm happy to talk to you today about toxicology data. Toxicology data UNODC is collecting on new psychoactive substances, which are mainly synthetic. So why do we collect toxicology data? Simply because toxicology is about health impact. And the international drug conventions also focus on health. Their main ambition is to make controlled medicines available and prevent their non-medical use. So both is to protect public health. But what are these toxicology data? Not everyone might be very familiar with what kind of data is that and what's the reality behind. So imagine your GP sends you to a health checkup. Usually that would include a visit of a lab to do some tests, right? The lab would typically take some biological samples from me, for example, urine, for example, or blood. So this is what toxicology works with mainly. Biological samples from persons, but other material, other matrices, how it is called, also exists, like hair. So in the context of toxicology, we're looking for substances which shouldn't be there. Because A, they might be harmful and cause a health problem. So think about an overdose event, a poisoning. So someone ends up in the hospital because they've taken something which causes a negative health impact, or even a fatality. So that would then lead to a post-mortem investigation. Or B, because someone is obliged not to use a substance, a drug, for example. Think of workplace testing for police personnel, military, or simply a roadside testing for substances which you shouldn't have taken and driving a car, or probation periods, people in drug treatment, etc. So there are loads of different realities, loads of different cases when toxicology tests come into play. And it's important to note that the data we're collecting here, the toxicology data, refers to so many different cases and situations, which all reflect different realities and populations. Now, at UNODC, our data collection on toxicology is all about new psychoactive substances. And that is why, because we know already a lot about the negative health implications of traditional drugs. We know the fatal concentrations of heroin, for example, in blood. So that is known. But what we don't know is what all these new psychoactive substances do to body and mind, and when they cause serious negative health implications. So this is not well established, not well studied, and getting that evidence is important for a number of processes, which I'm going to explain. Most importantly, the process of bringing substances under control, could be national control or international control, without evidence on harm. There will be no control. Now, let me try to pull up a few slides to illustrate what we do. I believe you see my screen, but it's not yet in presentation mode.
That is correct. Yes, we can see a screen, but no presentation mode yet.
Okay.
And you are now in the presentation mode. Please go ahead.
Perfect. Thank you very much. This gives you a brief overview about what is in our system. Over 7,000 toxicology cases relating to new psychoactive substances. And you will notice here with a yellow circle right in the center of this slide, that the number of different new psychoactive substances presented in these cases is quite high, but it's much lower than the number of new psychoactive substances we see in seized material, which means what we see in our toxicology cases is already kind of a reduced set of NPS. And it's those NPS which have come up in a context of health problems. So we are really zooming in here on those substances which have caused some health issues or other problems for users. You will also see a bit lower here that the cases try to classify the impact of the substance on a person. By saying, well, the substance was causal for the negative health outcome, or it was just contributing in some way, or we simply don't know enough to determine the relationship between the presence of that drug in the biological sample and the negative health outcome. Now we're zooming in further into the different case types, which I've already described. So a lot of these cases refer to driving under the influence of drugs. Others are post-mortem investigations or drug use cases, and that's a lot. We got a lot of drug use cases from Asia, for example. And you see that the different substance groups, the effect groups, are represented in different ways in those case types. Driving under the influence, we see a lot of benzodiazepines, sedatives. So what happens, obviously, is that people are being checked because maybe they're not showing the necessary driving skills. They're being flagged down and being tested to see what's the problem here. Whereas in the post-mortem cases, we see a higher number of synthetic opioids in the dark blue color. No, in the violet color. So that is not surprising. With the background, we know that synthetic opiates can have serious negative health implications and lead to fatal overdoses, particularly the highly potent synthetic opioids we see on the market these days. So all the different case types give a different window into the reality of health problems or negative health implications of using new psychoactive substances. And all of them present a different type of evidence which we can use. Now, I'd like to concentrate on a very specific group, but highly interesting group of synthetic opioids. They're called nitazines. And I'm sure you must all have heard about fentanyl and fentanyl analogs, which are also opioids. And these are the opioids, for example, which are leading to a lot of overdoses and fatal overdoses, for example, in North America. But in other parts of the world, other groups of synthetic opioids seem to emerge. And the nitazines, this is one of the latest groups emerging on markets, but they're equally potent to the fentanyl analogs. This is a very new development, and the system we have is part of our early warning system. So we want to capture these developments as early as possible and bring that information to audiences like yours. And you see here again in the center graph that this development just started 2019 and then has taken off quite strongly. Now we have 8 different substances just in the course of this year, and I'm sure there will be more cases being put into the system. This number will rise. Now, in the toxicology data, we have already identified 10 different nitazines in 151 cases, and many of them were fatalities. And in many of them, the nitazines have been found to be causal or contributory to the death. So we're talking about a highly dangerous group of new synthetic opioids, which is not yet well known and not well studied. And we're just seeing really the emergence of this group into the drug markets. Now we can ask ourselves what other evidence we have, whether this phenomenon is how widespread it is, how important it is. Now we're looking at a different set of data. We're looking at data from seized material. And what we see here is that also in the seized material, these nitazines, they come up very strongly in recent years. And it's a lot of findings, a lot of reportings. Now we have over 40 countries reporting these nitazines in their seized material. So this is really happening. And we see this, for example, here, examples from the United Kingdom, where just in the last 6 months, 54 deaths have been linked to the consumption of these nitazines. And there is evidence that these nitazines are being sold on the drug market in different shapes and forms, including in a form of tablets which look like pharmaceutical benzodiazepines. So there's a lot of risk elements here in this development, and it's important to capture that early, to take early action. Now the UK, for example, has already taken action and brings several of these nitazines under control. But also at the international level, action is already being taken based on all the evidence compiled by us and by other governments and institutions around the world. So for example, the World Health Organization is recommending one of these nitazines, the butanidazine, for international control in March 2024. And there are a few others which you see here on this table, like adenosine, etc., which have already been brought under international control. So action is being taken at the international level, but it's also important that governments are aware of that and look into this issue to take, if possible, preventive measures and to prevent these synthetic opioids to be sold openly and legally on drug markets and causing great harm. Now, I'm coming to the end of my presentation. Thank you very much.
Thanks very much, Martin. That was very interesting. Certainly in Australia, nitazines are becoming a problem, and we're saying, Amber and I, that in this country, that they're a bigger threat at the moment than fentanyl. So there is significant value in the toxicology data. And what we like about it is it's what we call real data. It's not a user perception in a survey. It's correct. Something you can cling on to in a forensic sense. to describe a problem and, as you say, identify emerging issues. So I think it's an incredibly important part of the data set.
Great, thank you.
Right. Now, what we'll do now, I think, is move on to the next presentation, which is from Dr. Heesung Kim from the Supreme Prosecutor's Office of the Republic of Korea. And the presentation will be on the topic of drug forensic intelligence sharing in Asia.
Thanks for the introduction. My name is Heesung Kim.
Dr. Kim, my apologies. We can hear you very, very poorly. Your audio level is very low. Can you please move much, much closer to your computer and we can try again?
I think I have to change my setup here.
And if you are using the
what about
iPhone,
it right now? Can you hear me
you-
well?
now I can hear you much better. Can we try again, please? Can you talk to me a
Sure,
little
sure.
bit?
Okay. Okay. My name is Heesung Kim, and I'm working for Supreme Prosecutor's Office of Korea. And I would like to share some projects that we are working on right now. And I hope to give, some feedback from you about, what you think. Let me share my screen.
And we can see your screen. Thank you.
All right. Okay, I'm going to start with some recent trend in the methamphetamine synthesis. And there are several ways, way more than couple, more than 10 or 20, synthetic way to produce methamphetamine. And basically, you use ephedrine or P2P. And we know these two compounds are highly regulated. But recently, some Mexican cartels use other, precursors, such as alpha-methylstyrene or P2MP or phenylacetic acid. And we know from our data, some Southeast Asia countries use pseudoephedrine or ephedrines, but they are slowly moving to P2P. And we have some problem with getting the root-specific impurities because some samples we are analyzing are very high, showing very high purity, and we don't have enough personnel to perform some research and development for these root-specific impurity analysis. And I'm going to start with some drug forensic intelligence on recent case. We have 3 cases, most recently on October 29th, October 27th, and November 4th. They are all coming from Malaysia, and they carry, all of them carry methamphetamine, 2.9 kilogram, 12 kilogram, or 3 kilogram. The smuggling method are also different. They use body packing, some use baggage claim, and their route is using the Kuala Lumpur airport to the Incheon, and one passenger they use Kuala Lumpur International Airport to Singapore to Jeju International Airport in Korea, and the last of them also using the Kuala Lumpur and Incheon Airport route. These are some drug profile information. Those look pretty much similar, and we found their melting point are very close to each other, and their chirality is D-methamphetamine, and their purity is more than 98.5%. They are almost 100% pure. And we also perform additional impurity profiling using gas chromatography and mass spectrometer. And as you can see from these 3 chromatograms, those look very similar, and we believe or we suspect they are from the same source. So I guess, they are using, one manufacturing source and distribute using different carriers. So my question is how to open an international investigation. And currently we are using, the analysis in Supreme Prosecutor's Office perform impurity profiling. And when we found the similar, similar profiles, we report to the drug investigator. And they are foreign personnel, and the investigator should contact embassy or the investigators in opposite country. But how fast can it be done? Or do they have any language barrier? Or what about some issues in collaboration, such as how you get personal information or cell phone contact? Those are the digital forensic areas. And finally, do we have any merit on opening an international investigation? And the question is, why bother? They probably stop investigating, and I don't know how they finish or close this case, but probably I'm not sure. Probably they are doing nothing about that. So we are proposing if we build a system, which can perform impurity profiling and upload impurity profile data to network, and those data, the forensic intelligence and report can automatically send to foreign country, and the drug investigator in foreign country, they can open a case if necessary, and the speed will be very fast. They can immediately open case, and there will be no language barrier because they are investigating in their own language, and there will be no legal issues. And probably there will be huge merit on successful investigation. And we propose data sharing models, such as if foreign laboratory, upload their, forensic intelligence information to, database, someone, probably UNODC or, ourselves, we can manage, the database, and, these data can be accessible to any users who are registered to this particular, the network. But there will be some issues in impurity profile data sharing, and there will be some experimental and instrumental differences, such as how much samples should we use, and what are some effective ways to extract impurities, and what about the instrumental condition. And there will be some differences in data format with different instrument vendors. So there should be some standard analytical method for performing these tasks. And also there will be some legal issues, such as is it legal to upload forensic intelligence information in your country? And what about some personal information? And who has authorities for server management? And there will be some other legal issues, such as ownership of data. And so, we propose some international guidance or agreement on this task. And Supreme Prosecutor's Office is planning to launch Asia Pacific Drug Origin Trace Analysis Initiative. The purpose of this initiative is to effectively block drug trafficking and fight for large drug crime organization. And their major goal is gather drug forensic intelligence information from participating countries and analyze this information and notify drug investigators and establish international cooperative investigation system if necessary, and perform R&D on newer synthetic load and route-specific impurities. And we are planning to promote this plan by advancing and standardizing of analytical technique, as well as establish database and search system for analysis results. And Also, we would like to have some scientific working group for the the chemist or forensic analysis, and we also have a plan to strengthen the analytical infrastructures for developing countries. So those are the plans that we are having right now. So I would like wrap my presentation for how you think about this proposed or project. Thank you.
Thank you, Dr. Kim. Many interesting questions proposed there, and yes, it's a very thoughtful presentation. We would not like to welcome Anselme Sanou from the United Nations Office on Drugs and Crime Prevention, Treatment and Rehabilitation section to present on the UNODC-WHO's facility survey.
Distinguished colleagues and delegates, good morning, good afternoon, good evening in your respective countries. I am Anselme Sanou from the UNODC Regional Office for West and Central Africa, and it is a great pleasure for me to present our work on substance use disorder treatment facility survey as a tool to support planning and monitoring of a responsive treatment system. The UNODC-WHO international standard for the treatment of drug use disorders were developed by the UNODC and WHO based on a strong international policy mandate and based on existing guidance. It has become an internationally recognized reference point, providing a public health framework for the development of a drug treatment system and evidence-based drug treatment services. The facility survey, together with the international standard for the treatment of drug use disorders, the treatment demand indicator, and the UNODC treatment quality assurance tool, form a basic suggested package for treatment planning and monitoring. The facility survey is a survey which is conducted to map the treatment of substance use disorders in a country. Measuring the demand for treatment of substance use disorders is vital for monitoring changes in the pattern of drug use in the community and in planning a responsive treatment system. The survey has been developed in the framework of the UNODC-WHO program on drug treatment, drug dependence treatment and care. The goal of the facility survey is to map the treatment of substance use disorders in a country or in a region to support planning of a responsive treatment system for treatment of drug use disorders, especially in absence of more comprehensive drug information system. The facility survey consists of several sections, such as details of the survey correspondence and for the general public, the description of the treatment facility and the treatment offered, the number of people treated, and also the treatment capacity, including the buildings and the staffing. It is very easy to administer and is available in more than 10 languages. It is possible to do the facility as a paper-based data collection or an online data collection using the drug monitoring platform. It is self-administered. It is a self-administered questionnaire. It needs input from relevant substance use disorder treatment service providers, including primary health care, specialized treatment center, mental health clinics in a city, in a region, or in the entire country. The facility survey has been implemented in several countries in Europe, in Africa, in America, and in Asia. It was already completed in more than 22 countries. It has an important tool for treatment planning in line with the international standard for the treatment of drug use disorders, and is especially useful in the absence of other routine data collection systems on treatment demand, drug use, service accessibility, and in this way can also play a role in improving the nationally available data that will be included in higher level data collection exercises, such as the annual report questionnaire. Some completed national and regional reports are available in our website. For example, the one from Southeast Asia, from Latin America and the Caribbean, from West African Francophone countries, another one from Central Asia is coming up. This is an example of the West African Facility Survey we report. In the facility survey, you can see a limited access to drug treatment. In yellow, for example, you can see the regions in each of the different countries, 9 countries in total, where we don't have treatment facilities. And in red, you have regions in the different countries where you have treatment facilities. In a way, facility surveys can be used to generate a consolidated analysis of substance use disorders treatment accessibility, affordability, and diversity, as well as the geographical distribution, the type of facilities available, the services provided, the resources available, and the consolidated patient information. The facility surveys are important steps to understand the capacity of treatment systems, assess their quality, and plan for improvement in line with the international standards. The facility survey supports the preparation of the key quality standards for the appraisal of drug treatment services, which include effective management of the service, individualized patient-centered treatment and care, timely access to treatment-based interventions, and promotion of patient health, safety, and human rights. For more information, we have our website, which is available. Feel free to contact us if you have some questions or need more clarifications. Thank you very much.